Hey, everybody, it's Dr. Eric Balcavage. We're back for another edition of the Thyroid Answers podcast. We have another guest today. His name is Josch Dech. He's a holistic nutritionist and GI expert, I guess, at this point in his career. And he also is the host of the Reversible podcast. And we're going to be talking gut health, and maybe we'll tie into that, how it impacts the immune system, how that can impact thyroid physiology as well. But really probably a more in-depth discussion and maybe a different take on gut health than maybe we've talked about in the past. So, Josh, welcome to the Thyroid Answers podcast.
Eric, it's a pleasure to be here. Thanks so much for having me on board.
Absolutely. So, uh, give my audience a little bit of a background of who Josh Dech is and why we should be listening to him about gut issues.
Well, first of all, you shouldn't be listening to me. You should maybe take the things I say with a grain of salt and back it up yourself and do your own research. But the gist is, I used to be a paramedic. I realized very, very quickly I was in sick care, not healthcare. We pick the same people up for the same things over and over, and you'd see them a couple of weeks later for the same thing. They go to the hospital, get an increase of dosage on drug, or get a new medication, and that's all it was. It was cyclical until they stopped calling because they died. And so I wasn't enjoying sick care. And so through a happy chain of accidents, I ended up in the personal training space in my early 20s. And it was really amazing, actually. This woman, Lynn, came to see me at 57 years old. She had 17 pills of insulin for breakfast, 9 pills of insulin for bedtime. She was dealing with high blood pressure, slept with a CPAP. She was actually on the disability list at work at the time. And I do believe she was dealing with hypothyroidism as well, a bunch of gut stuff. Long and short, we cracked into nutrition, basic stuff, and health and wellness and strength. 59 years old, she broke a world record as a weightlifter in the raw powerlifting division. And the rest was history. After that, I just was enthralled by the human body's ability to heal itself. And I started going to conferences and more shows and all kinds of stuff to try to learn more about nutrition and wellness. And I heard someone talking about the gut microbiome in my early 20s at a stage presentation at a trade show, and just the complexities and how it works. And just the overview was enough for me. I thought that is what I'm going to do for the rest of my life. And here I am now. I specialize in Crohn's and colitis.
All right. So, how did you get into Crohn's and colitis as kind of the specialty?
Yeah, funny enough, again, more happy accidents. My life is just a snowball of oops. So when I started in this, I was working with all kinds of people for diabetes and weight loss resistance and all sorts, but everybody, depression, anxiety, skin, arthritis, whatever it was, it all came back to the gut. And the more I started talking about the importance of the gut, people just came to see me. I saw a lot of irritable bowel and some other acid reflux and bloat and other issues that we're able to fix relatively easily for the most part. As you know, of course, a lot of cases can be very tricky, depends on what's going on. But the more severe the cases I got into, the more severe the cases came to find me, until I found my first ulcerative colitis case came knocking on my door. And within 90 days, they were in full clinical histological remission. CT enterography, colonoscopies were all clear. And that was when I realized that something more can be done. When the doctors say so easily, it is what it is, it's autoimmune, there's nothing we can do, you're a lifer. Whether you're 5 years old or 50 years old, it's the same blanket statement on everybody that there's nothing we can do, so here's some drugs. And I realized very quickly that it is more of an autoimmune spectrum, which I thought was a term I actually invented. Turns out Amy Myers did it first. And so this autoimmune spectrum, I realized most people are somewhere on the severity scale, but not everybody is truly full-blown autoimmune. And some people can be fully reversed rather easily, depending on what's going on and the severity of the situation, how long they've had it in the work. So it's been a really cool process and getting through here. And it never ceases to amaze me, the amount of things we uncover.
So, let's talk about that a little bit. I hate the term autoimmune,
Mhm.
just so you know, because I think it denotes to people that their immune system is attacking them for no apparent reason and that their
Mhm.
immune system's out of control. And that's why allopathic medicine says, hey, there's nothing we can do here because it's your immune system's attacking your own body. And I think it's a terrible message to give a patient um, and somebody who's struggling with chronic health issues to say, hey, your immune system is attacking your body. There's nothing you can do.
Mhm.
And I like to give my clients a different perspective that their immune system is a defensive um, system. And most often, your immune system is trying to protect you, not destroy you.
Yes.
And so if we look at it, this is an immune-driven disorder, and the immune system's trying to protect us from something. Now we have something to work towards, right? Well, now we just have to identify what are the triggers that are driving the immune system to think that the cells, the tissues are threatened. And it doesn't matter to me whether it's Hashimoto's, thyroid disorder, it doesn't matter what the immune-driven disorder is. If we just say it's autoimmune and the only thing we can do is suppress your immune system and manage your symptoms, the person might as well just enjoy life and do whatever the hell you want to do because you're screwed anyway.
Yeah, food doesn't matter, whatever you want, what the GI
doesn't matter,
say.
Right? My immune system's out of control anyway. But as most of us in this space, a lot of us have our own stories of immune issues and have recovered, and that's what gets a lot of people into this space. But I think that whole idea that it's autoimmune sets the stage for potential problems. Although I use that term periodically. I'm like,
Sure.
I hate using that term. So let's talk about that, because the number one driver of thyroid problems with the gland is an immune-driven disorder, and the number one cause of reduced T4 to T3 conversion is an immune inflammatory driven disorder. And probably the number one driver of gut-related disorders and what stems from that tends to be an immune-driven disorder. So what is driving the imbalance of the GI tract and upregulating the immune system from your perspective?
Such a great question. It's so varied. It's really interesting. So I don't use the term autoimmune either. I have to use it to relate to people because that's the language that they speak from what they've been told, but it is a severity spectrum. And so when I see these chronic inflammatory conditions, I really look at them under two umbrellas. Number one, it's really the only two ways people get these diseases anyways, minus we talk about, say, genetics, right? There are certain genetic factors that can contribute to it or make you more prone to, but you're not just born as an infant with ulcerative colitis. But I mean, if we go back to the triggers from early onset age, we know that there's 280 some odd chemicals inside an unborn baby's umbilical cord. That's a Red Cross study published by the Environmental Working Group in 2004. We know the average adult has up to 700 plus chemicals. So we're constantly fighting this uphill battle. That's immune issue number one. The other one we can look at, of course, we say it's autoimmune. They also say it's idiopathic, right? So no known cause. Now, I did a lecture on this recently talking about these inflammatory disease processes. And back in 1990, according to the CDC's own data, there were about 1.5 to 3 million-ish cases of IBD around the world being actively treated by a doctor. By 2020, it was about 7 million, a little bit north of that. So it can't possibly be idiopathic. And if it is, like, we better figure it out pretty freaking fast because we got a problem on the rise. We've 5x'd our cases. And then if we look at North America being less than 5% of the world population, they have more than 50% of the global cases. So it can't possibly be just genetic because that's a statistical impossibility. And so I look at two ways this disease actually happens to people. Number one, it's acute. There's a direct insult of some kind to the area, be it a mold infection, a bacterial dysbiosis. If there is, I got a girl right now, 30 doses of antibiotics in the last 3 years from her doctors, just trying to chase UTIs. So we see these things all the time, a chronic stressor, something else, or it's a wear and tear. I got a fella, had his gallbladder removed under a high stress situation about 16 years ago. Many years later, developed IBD. We traced it back to dysfunction, liver flukes, the works. So it's either acute or it's accumulative. And those are really the main two ways that I see people developing these diseases.
Yeah, I would agree with that. In my podcast, my book, I talk about it's typically the load, not the thing for most people, because we're all exposed to individual things. But typically when we have an excessive load of stressors, diet, lifestyle, sleep, disruption, alcohol, antibiotics, medications, all these things, the load becomes excessive, creates more damage than we can repair, or triggers that cell danger response. And now we change and shift the physiology from what we call homeostatic regulation to more of an allostatic regulation. So instead of putting more time to healing and repair, we're putting more time and attention to cell defense.
Always.
So What do you think? We talk about there's things that can drive it potentially, and usually it's a story, and you look at somebody's health history and their health timeline, and you can start to see, all right, these are the things that probably got us to here. Even antibiotics. I mean, at one point, people said, hey, there's no bacteria in the gut anyway, so we can take these. It's not going to create a problem. Now we know we're loaded with bacteria. And we now know, I think it was a paper, I think 2000, 2022 or 20, even maybe last year, where they talked about one round of antibiotic may change the biome, and we may not see the influence of that change for a minimum of 5 to 10 years. And
Wow.
who is tying that together 5 to 10 years later? Nobody, right? So we just don't think, hey, I went to my dentist, I have to get a tooth done, I'm going to take an antibiotic for a week just to get that done. And then we don't realize that that could set the stage down the line for a change in the microbiome and altering the course of gut physiology. So what is, we think about what goes on in the gut. What is I think that right now we've got so much stuff about gut biome that there's stuff we know, and there's a whole bunch we don't know.
Of
So
course.
how does somebody know that they have some level? Let's talk about what the biome is, and then discuss a little bit of what dysbiosis is, just in case there's people that don't know those things. And then we'll talk about how do we know that we've got some level of dysbiosis.
Sure, that's a great question. So our microbiomes, we often think about it and okay, it's my gut. We're hearing the term more and more. It says gut biome. Microbiome means gut, but really we do have microbiomes everywhere. They are all over your hair, your eyes, your sinuses, your mouth. There's microbiomes in everywhere in your body. And we even used to think that the placenta was sterile, but now we know it's teeming with microbes. And so we know even just your gut microbiome that there's about 100 trillion bacterium in there, outnumbering your own cells 10 to 1. You have about 10 trillion cells in your own body, 100 trillion in your gut. And even genetic material, so what, 23, some will say up to 26,000 different genes. We have about 3 million genes we suspect inside of our gut bacteria. So we have 130 times more genetic material there. It influences everything we do, from personality, how social you feel like being, your mental clarity, moods, behaviors, all kinds of cognitive dysfunction or mental health disorders. It can be connected. In fact, 93% of the leading causes of death, Eric, we see. I mean, look at the CDC, right? Heart disease, cancers, cerebrovascular disease, chronic respiratory issues, diabetes, Alzheimer's, kidney disease, liver disease, Parkinson's, hypertension. All these can be connected back to the gut in some way, shape, or form. Either the gut may be responsible for or plays a large role in. And theoretically, again, there's a great paper by Dr. Alessio Fasano called All Diseases Begin in the Leaky Gut, talking about the role of zonulin, which I know is quite popular now. And so we know the gut has a massive, extensive role that we're still just learning. Even if we go to test someone's gut bacteria through a GI map, which I'm sure you've done many of those in your time as well, maybe you can see 100 million different bacterium or 100 bacterium on there on a really good one, like Vibrant Wellness or whatever else you might use. The unfortunate part is if we have several thousand species and several thousand different strains, we have tens of millions, maybe 20 million-ish different types of bacteria and species. And so we can't possibly test them all. We don't have the technology. We'll be 50 to 100 years away. And that's why a lot of doctors, I think, don't really like them, as it's not a complete test. But what we can test is extremely actionable. And we know the influences. We're studying more bacterium. A great trending one lately is Akkermansia. We can see its role in even things like PCOS. So our bacterium is so broadly covering so much of our health and wellness and what we do. It's at the core of everything. It breaks down, digests, and absorbs. It produces vitamins. They're anti-inflammatory. They do everything for us. And I argue that they are comparably important as our DNA.
Yeah, I would agree with that. And it's been said, for the listeners, we've got brain one, right, which controls a lot, but then we have brain two, which also contributes a lot. And there's a feedback loop there for the brain physiology, and a lot of signaling that goes on. And so what does go on in the gut influences neurotransmitter function and influences hormone regulation, thyroid physiology, blood glucose regulation, as you said. So there's so much that goes on in the gut that then impacts where we are in our level of health. So there's people that argue that GI testing, um, obviously in an allopathic world, um, they're not doing similar testing. Like if somebody's in an allopathic world, I don't think they hear the conversation of dysbiosis when they go to their GP.
Mhm.
Like, okay, you probably have dysbiosis. What makes what typically we do in functional medicine different from allopathic medicine and how they might assess a GI tract, which is why maybe somebody gets a diagnosis of irritable bowel syndrome and management of irritable bowel and allopathic physiology, but comes to a functional medicine practitioner, and a functional medicine practitioner might say, yeah, you have irritable bowel syndrome, but that's being caused by something. And somebody says, no, I had testing done. My doctor said the assessment showed that everything is normal. I just have uh, irritable bowel syndrome.
Mhm. Well, it's interesting because allopathic, they're very Western medicine, I love for a lot of reasons. They're great at emergencies, they're great at surgeries, some of the best in the world, but they treat everything like it's acute, right? Chronic inflammatory conditions, get some kind of medication, some kind of short-term treatment, they just leave you there for life. And so allopathic, when they look at a gut issue, and let's use the Crohn's colitis example anyway. And for the listeners who don't have Crohn's colitis, this is all relevant. It is a severity spectrum. Anybody can get Crohn's colitis under the right circumstances. And so if we look at this, allopathic does one thing. Number one, they'll go through and assess your symptoms so that they can, number two, give you a diagnosis. With that diagnosis, they go number three, which is your medication. So we'll give drugs 1, 2, 3, 4, 5 in this order. If this doesn't work, we go to the next. If that doesn't work, we can just take the organ out. No big deal. You'll be fine. And that's allopathic. They always ask, what is going on? So a patient goes to the doctor, hey, I'm having blood in my stool. Hey, I'm having loose bowels. Hey, I'm having bloat. I'm having pain. They go, great. Here's your diagnosis, your drug. Functional medicine practitioners, you can tell us what's going on, but that's the least of our concerns. We want to know why. Give us the history. Most Americans, I think, get 7 to 11 minutes or something with their doctor. Canada, maybe 10, 12. And so we don't have time to go through a history. They'll go through and symptoms, diagnose, drug. Functional, we can spend hours. It's all private pay. We got the time. And so we'll spend half hour, hours. I know some practitioners spend 2 to 4 hours with their patient the first day to go through, build a history. So if someone comes to me with ulcerative colitis, and we go back, great example I've just seen recently is a fellow in his mid-20s from a Jewish descent, Jewish family. His doctor said you have colitis because you're Jewish. It's genetic. It's just, I see you rolling your eyes there, and 100%. And I thought that's a cop out. That's a crap answer. Well, we did a thorough history. Turns out he started a job in HVAC. And so 2 months in, he got IBS, diagnosed with that. 6 months after that, he was diagnosed with IBD. And so his doctor said, what? It's IBD. We said, why? It's HVAC, it's mold, ran a toxin panel. He has OTA or ochratoxin A infection, very rampant. And like, that's at least the low hanging fruit. Let's start there. 3 weeks in, he's already feeling better. We started with the colloidal silver, bing, bang, boom, right? And so that really is the allopathic versus functional. Allopathic says what, functional goes why and how and when. And then we build a history and undo the damage from there.
Yeah, and I'll add to that the assessment's different, right? And so in the allopathic world, they are looking for pathology to treat, right? And so there's something called the Rome guidelines where they say, okay, they got these signs and symptoms. This is a potential diagnosis. We're going to do some type of a scope or an exam to look for pathology that we can cut out or treat, right? If there's no pathology to treat, even if you'll see these on reports, right? No pathology, redness, edema, no pathology, right? Well, if there's redness and edema, there's dysfunction, right? But to be fair to the allopathic profession, they're looking for a disease to treat. If there's no disease, then it's a watch and wait scenario. You may get diagnosed with some type of IBS, and then you're going to get your symptoms managed. And the guidelines would tell you to recheck that test again and see if there's a pathology next year, right? And if there's no pathology, then you're going to get more medication and more treatment. It's all about the management. And if you ask, I think a lot of physicians in that model, they're going to tell you, we don't know. It's idiopathic, right? An idiot can't determine what it is. I don't know how, what the answer is, but they're not taught that there's a dysfunction that creates pathology or disease. And so what we're really trying to do in functional medicine is assess function. And that's why our assessment's different and our testing's different, because you'll hear this a lot, I'm sure. Hey, I had a GI test done. There's no parasites, there's no eggs, there's no, and they're testing for the big pathogens, right? When they're checking a stool test, and it's just a pathogen-based test. And that's it. And they go like, yeah, they said everything's fine. Well, there's a lot more going on to assess than just, is there pathogenic bacteria or and really, I don't really even know that I really see that many parasites tested from people that are getting checked for chronic GI issues.
Very
So
rare.
if somebody's got GI signs and symptoms, some people don't recommend functional GI testing. I think functional GI testing for a lot of people can be very beneficial for a couple of reasons, but I don't think the testing that a lot of people are doing is probably the best. There's some companies out there that just provide biome testing and say, okay, here's all the bacteria, so these are the potential problems you have. I don't think that's the best testing. I think there's function to test that tests functional markers. It tests steatocrit and zonulin, and they test short chain fatty acids, and they test elastase 1 and inflammation in the GI tract. Do you find that those tests provide value from a functional perspective?
I do actually. And it's all lens. It's all because you can look at the same thing, right? There's a classic picture. There's like a number 6 drawn on the ground, and one person standing at the base going, "That's a 6." The other person standing across goes, "No, that's a 9." And so you can take the same information from different lenses and it becomes relevant. Great example, guy just brought in recently dealing with inflammatory bowel, has got ulcerative colitis, and his GI map, his stool looks surprisingly good, but his beta glucuronidase was 6,400. It's the highest I've ever seen. And so now we can actually go back. He's got steatocrit is high, fecal fat is very high. So he's clearly not digesting. There's a liver issue. We're suspecting even liver flukes. His glucuronidation pathways are messed up. He's not detoxifying. He's got biorecirculation issues. And so that testing, to me, with our other questionnaires and symptomatology, gave us a different direction to look. Whereas some people might look at that and go, well, beta gluc is high, it must be bacterium producing it. It's pathogens, it's whatever, it's overgrowth, these whatever your production bacteria is. But when we look at all the pieces as a whole and we draw them back in, then we can see the picture. We trace the function on the test. We look at, well, okay, fecal elastase is very, very low. Well, it's very, very common. We see some kind of endocrine pancreatic insufficiency of some kind. 85% or so of people statistically will develop some kind of gallbladder dysfunction when they have inflammatory bowel. So we can trace these things back and figure out which came first, the chicken or the egg, using a lot of these labs and tests. Are they a conclusive answer by themselves? Very rarely. If someone has dysbiosis, right, complete imbalances in the bacteria, you mentioned pathogens. Your hospital tests for your C. diff, E. coli, salmonella, varicella, adenovirus, EBV, sometimes. If they don't detect it, they say you have no bacterial issues, you're fine. Well, your good bacteria, you could have a SIBO condition. It could be way overgrown. It could be way undergrown. And the opportunistic bacteria that in many tests is actually classified Morganella, Provotella, Citrobacter, these things that are natural inside the ecosystem of your gut are opportunistic. They can overgrow and then cause problems. And so we need to see everything in ratios. And then again, the question is, if they're out of balance, why? That's always what we want to go back to. What was it? Antibiotics. 5-year-old comes in with his GI map and his bacteria is all lit up. I'm not thinking it's antibiotics. I'm looking at mycotoxins. I'm looking for a mold test. And that's how we find these things. They're definitely good direction pointers for sure.
Yeah. I think the benefit of the test is it, as you said, it helps provide more data as to why somebody may be symptomatic. And 2, where do we go from here? Like you mentioned the beta glucuronidase. And for the listener, beta glucuronidase is an enzyme that's typically generated by some of the bacteria in the gut. You need some beta glucuronidase. It helps conserves hormones and other things that thyroid hormones is a great example that gets glucuronidated by the liver. And as it's coming out to the GI tract, if the body wants to, save some of that thyroid hormone and recycle it back into the system, it takes that glucuronic acid off with this enzyme beta glucuronidase, and then it kind of recycles back into the system. But if you have too much beta glucuronidase, now you can have hormones, toxins recycling into the system. And especially in women, estrogen is one of those big things that then can get recycled into the system. And you were talking about elastase 1, and we talked about gallbladder function. We talk about estrogen. If you've got too much estrogen in the system, that actually creates constriction of what's something that's called the sphincter of Oddi. And the sphincter of Oddi is this little sphincter muscle where both gallbladder and bile duct come together and are released through the sphincter of Oddi. Well, if you have too much estrogen in the system, the estrogen keeps that sphincter of Oddi clamped tight. Now you can't get digestive enzymes into the GI tract. You can't get bile flow into the GI tract. And so you are going to have problems with bacterial overgrowth, small intestinal overgrowth of organisms, leaky bowel issues because you don't have the bile acids to help maintain those tight junctions. So these tests, while somebody might not have a drug per se to treat some of the things that we see on a functional GI test in the right hands, and looking at it from a different perspective, we can look at those tests and say, okay, low pancreatic enzymes, gallbladder issues, we likely have, and we got elevated beta glucuronidase. All right, I've got an estrogen issue that's creating a problem here. I got to deal with that. I've got a bacterial issue. I likely have also problems with thyroid hormone because I also need, if it's appropriate levels of T3 to convert that T4 or to have that sphincter work. And now we can start putting together a strategy to help address somebody. And instead of maybe just being, okay, let me try this, we can be a bit more strategic and get maybe more closer to the root issue of what's going on.
And Eric, if I get too medical as well, sometimes I get really excited. I love this stuff. Please do slow me down. I want to make sure we are making sense for the listeners as well.
Oh yeah, I think this I think my followers there's regular everyday people that are struggling with health issues and a lot of practitioners that listen to the podcast. So I often get a little into the weeds on the sciencey part because I think that's what helps people understand. And we just say, oh, you have leaky gut. Okay. But I think people need to understand what leaky gut is and why they get it and some of the important things. So when somebody says that to them, they go, okay, but what's driving it? Not just you have leaky gut, but what's driving it? Mm-hmm. But what are if somebody's got GI-based issues, Crohn's, colitis, obviously you're going to look for potential root causes, but what are the things that we can do and where do we start? Regardless of the condition and what the diagnosis is, where do we start to improve somebody's gut biome, gut health, digestion, and overall health and well-being?
Is that where do we start assessing as practitioners, or where does the client or the patient start?
I'd say let's start with client who isn't ready for the practitioner yet. Let's give them some general advice as to, okay, you've got GI symptoms, you've got gas, you got bloating, you got constipation, you got loose stools. Nobody's diagnosed you yet and you're not taking anything that's prescription to treat your GI disorder. So where do they start? Where would you recommend they start?
It depends, of course, always, as you know, on the starting position. Let's assume it's kind of the average American dealing with problems, is looking for some solutions, hasn't really explored much. And we start there, kind of like ground floor. Most people were eating fake foods, artificial foods your body can't digest, doesn't understand what to do with. Most of them, it's half chemicals. They get stored in the liver and fat cells and all kinds of places. It causes a lot of problems. So first and foremost is always the obvious. Eat food your great-great-great-grandmother would recognize as food. If she wouldn't recognize it, don't eat it. But we always talk about what to eat. That's what every nutritionist, every health coach wants to talk about, what to eat. Very few people really talk about how to eat, because so many of us do this dashboard dining, right? Everybody knows the mom or the dad running kids to car, 5 kids to soccer, shoving them in the car, hit the drive-through, throw something in their face so at least their belly is full. We're not stopping. We're not chewing. We're not actually producing digestive enzymes adequately. We're in this fight or flight state all the time. But the difference to sit, to take a couple of breaths, to just slow down, to chew your food 20 or 30 times, even the process of actually getting into the kitchen, handling your food as you cut it and cook it has been shown to improve digestive motility and digestive enzyme production so you can break it down adequately. Like, a great experiment any of the listeners, think right now, if you're driving, don't close your eyes. But just think of a food, like it's an apple pie or a juicy steak, whatever your favorite food is. You can feel that salivation, right? Your body is preparing you to eat food. It's producing saliva to start breaking down food in the mouth before it gets to the stomach. And we can feel that in our mouth. The same thing happens in our gut. The more you think about food, you'll feel your stomach grumble 5 minutes, 10 minutes, because you're starting to turn up those hunger hormones. You're starting to produce those enzymes. Your body is preparing to eat. But very few of us actually prepare. We just go, chew 3 or 4 times so it's small enough that we don't choke. It fills our belly. We're happy. We walk out. So we're not going to adequately break down, digest, and absorb, which is the primary function of the digestive system, is break down, digest, and absorb. And so we have to at least start at the ground level there. Eat real foods your body can break down. There was a great story that went semi-viral or viral recently. Maybe you're familiar with the study. I forget who did it, but they gave participants a soup with homemade noodles. They had the eggs and the flour, and they made the soup, and had them drink it down with a glass of water when they were done. And the other group, they gave them ramen noodles, like those Mr. Noodles in a package with the sprinkle seasoning and heat in hot water. After 2 hours, group A, of the homemade noodles, was almost entirely broken down to liquid. Group B, the noodles still had teeth marks. So they weren't breaking down at all. And that's the problem with these artificial foods. If they have preservatives to preserve on the shelf, they're not going to break down on the shelf. They're not breaking down in your body either. And so those are our 2 main things that we can do to help improve our health, is eat real foods and just slow down. If you can't, honestly, take it as a fasting day. You're probably better off.
Yeah, I mean, that's like step one of instructions for me of my patients. And yeah, I hear from people like, come on, Eric, get real. I'm trying to feed a bunch of people. I'm cooking a bunch of meals. I don't have time to sit down and eat. Well, and I tell them the same thing. Well, then skip it. Because you're probably not going to put yourself in a position to digest that food to begin with. So it's going to create potential problems. And it's not unusual to have a person kind of read those guidelines. And in my initial guidelines, I talk about sitting down, resting. I think the whole idea of, whatever your thought process is on prayer, but the idea of sitting down and praying before the meal is one of those things, because it's preparing you to slow down and get ready for a meal. The other things, cooking and just taking the time and just getting yourself in position, but chewing the food becomes really important too, and really breaking that food down. And I think, and I don't know how scientifically this is done, but I usually tell people, if you're thirsty during the meal, you're probably not chewing your food up enough. That's usually a good sign that you're not chewing enough. You need to slow down, put your fork down, chew your food. And if you're constantly drinking water as you're eating, you're probably not taking enough time to chew your food up and eat.
That's really interesting. I never thought about that.
So it is there, and there are controversies, because some people say that if you drink with your meal, it reduces, your stomach acid. That there's controversy whether that's true or not true. But I think it's simpler than that. If you're that thirsty, if you're drinking a glass or two of water or whatever with your meal, you're not taking the time to really probably chew your food up, and you probably just ease back on the whatever you're drinking, and spend more time chewing up your food, because that, as you said, it starts the breakdown process. The saliva has a lot to do with breaking the food down, starting to kill some of the organisms that might be coming in on your food. But what's next step they can do?
So after we've eaten real food, after we've chewed, if you're still having issues on a very basic level, some people can just supplement a digestive enzyme and feel really, really good. And eventually the body corrects itself. So it's a whole kit and caboodle to open up here. But long and short, if you've been eating garbage, like a lot of us eat like raccoons, whatever we can find, we just put it in, don't care where it's from or what it is, and it gets into our body. But all those toxins, your body does a great job of detoxifying itself. But sometimes there's enough buildup and backup, we'll say, as a kind of a simplified version, that you're not going to be able to digest adequately, or you're going to be compromised, you're going to be inflamed. And with inflammation comes compromise, right? If you have a swollen ankle, you can't walk at the same pace. If your gut's inflamed, you can't digest at the same pace. So sometimes supplementing a digestive enzyme for a few weeks to see if things, mull themselves over after eating really well and slowing down, maybe that's all you need. But if you have a very complex situation, if you're dealing with a lot of acid reflux, the number one cause for acid reflux I see in my practice is low acid. It's people who are chewing too quickly, swallowing too much, under a lot of high stress, constantly in fight or flight. And we often will give them more acid in the form of apple cider vinegar or HCl, case dependent. And typically they can feel great. But if you have severe dysfunction, sometimes it's buffering out the liver. Like if you go to your doctor, if your liver enzymes aren't particularly high, they'll say you're fine, but symptomatically, you can still have other issues. You could get an ultrasound and still show fatty liver and maybe not necessarily have sky high liver enzymes. And so maybe doing some kind of liver flush or liver detox by simply giving your body the nutrients it needs to do its job. Because many of us are overfed and undernourished because our soil is crap, our food is crap, everything's artificial, everything's dead. And so we're undernourished. We're not getting the vitamins and minerals we need. And so that's my next step would be digestive enzymes, supplying your body with proper, absorbable, bioavailable nutrients. And then if you're still having issues, definitely look at seeking a practitioner, case dependent.
Yeah, and I would agree with that. I think as we have more stress that we're dealing with, as we spend more time in a chronic inflammatory state, as we get older, the body uses energy for the thing that's most important. And so if dealing with chronic inflammation, chronic dysbiosis, blood pressure issues, the inflammatory triggers, as those become more of an issue, the oxidative stress that's going on in the body, it's not unusual that you see somebody's stomach acid reduce, digestive enzyme production go down. Even people with blood sugar issues and diabetes, it is not unusual when you do a functional GI test that you'll see their pancreatic elastase down, and that's probably shouldn't be a shocker. And if the astute clinician, in my opinion, would pick that up and say, maybe one of the primary reasons why you have low pancreatic enzymes is because your body is struggling to manage the glucose dysregulation, the glucose resistance. And so the pancreas has a unique ability to convert pancreatic enzyme producing cells to insulin producing cells when there is blood sugar issues. So I think that again, this is another reason why those functional tests become important, because, hey, oh, wait a minute, you got blood sugar issues, your insulin's high, your glucose resistant, I prefer. And maybe the body is saying, we don't need those digestive enzymes. We need to make more insulin. And we definitely don't need digestive enzymes. If I already got way too much glucose in the system, why would I even need to eat more food? So the dealing with the glucose I have in the system is the priority, not breaking down more food that's coming in. So not an unusual thing to see there. But I do think digestive enzymes. Yeah. Right? Well, we only have a limited amount of resources, right? And so cells are like people. Like, what is the most important thing to do? Make enzymes and hormones and things to support digestion, or make inflammatory molecules to protect myself, right? So cells and tissues are going to do what's most important to them, not what is most important to you or me as a whole. So let's talk about stomach acid for a minute, because this is a topic that influences maybe 50% of the US population, which is the story that everybody has too much stomach acid and needs to be put on antacids, versus the functional medicine story, which is they probably don't have enough acid. Especially coming from a medical perspective, where did that all change for you? Or maybe it hasn't changed.
No, I definitely still agree that most of us are underproducing. I mean, one, we're undernourished. We need all kinds of certain vitamins and nutrients and minerals. We're all zinc deficient. Like, there's so many issues we have. We're not producing enough stomach acid as a nutrient level that I would see. And again, in practice, we say, well, it makes sense, right? That I'm having reflux, therefore I have too much. It's not being held in my stomach. But if we look at the sphincters, the pH and pressure sensitivity, it also makes sense. We need acidity and fluid volume to keep those closed. So therefore, having acidic fluid or stomach acid will keep them closed. But people who are low don't have those signals sent back. Those sphincters open up. So you bend over, lay down, eat, whatever it is. It comes back up as your stomach's mechanically churning food. It splashes back up and you're getting this reflux and this heartburn. And so it just really makes sense. The reason I can say this confidently is in practice. My wife, for example, really high stress, she gets a little acid reflux. I give her a shot of apple cider vinegar and some water, boom, it goes away. My clients, 99% of them who have acid reflux, we have them stop, slow down, and chew. That might fix it. But the rest, we can add some acid in the form of like a betaine HCl supplement or we can use an ACV, like apple cider vinegar diluted in water, because that will burn going down. So if you guys want to try it, mix it in water. But 99% of the time, that fixes the problem. And so I can say, clinically speaking, that adding more acid, the problem goes away, their digestion improves. I don't need to do testing. I don't need to do scoping. I don't need to get into the stomach and see, endoscopies to see what's actually going on, because we added acid and it's fixed. It doesn't take a rocket scientist.
Yeah. For the listener, just so you know, like the stomach is this big balloon and there's a sphincter muscle at the top and there's a sphincter muscle at the bottom. And when you start putting food in, that sphincter muscle at the bottom should be closed and the one at the top is a little bit open. But as you put food in there, now the stomach, if it's functioning well, is going to start to release acid. And the acid in the stomach, as it increases, it drops the pH. And the pH of the stomach can go down to like a pH of 1 or 2, which that would eat through my desk, right?
Battery acid.
Right. Now, your stomach has a lining to deal with that, but your esophagus does not have the lining to deal with that. And so when you're hearing that discussion from your doctor that you have too much acid, you have too much acid coming up into your esophagus. And so, yes, it will damage the esophagus. So what they're Barrett's esophagitis, or, they'll call it any type of esophagitis, is inflammation of that tissue. And what they're typically giving you the antacid for is to do exactly what they've been taught to do. There's a disorder, a disease I can manage or treat. I'll reduce the stomach acid, therefore it won't burn your esophagus and rot it out. But they haven't fixed the actual issue, which is, if I had enough acid in the first place, the sphincter muscle would have been closed. I wouldn't have had the reflux come up and damage it. And so ultimately, taking that antacid does stop the burning, but it doesn't stop the reflux. You're still refluxing, but it also sets the stage for other conditions. Would you agree with that?
So much. I mean, you talked about so simply, like the pH in the mouth, it's not highly acidic. Otherwise, anything you eat would melt away. So it's not super acidic. It can kill some bacterium coming in, but it's not going to kill everything. There's a huge gate change coming into your stomach. Like that pH will kill a lot of bacteria before allowing things to get into your intestines, where most of your bacteria lives, in your gut. And so if you don't have stomach acid, one, you're not breaking down, digesting, absorbing, which one could argue it causes inflammation on the way through because your gut's not meant to deal with that. You're not controlling a lot of the bacteria. So you have invaders coming in, you got things coming across the border, no one's checking the trunk, there's a bomb in there, right? Who knows? And so these things are getting into your gut. And you have this really beautiful homeostasis where it's this perfect balance of bacteria, the good and the bad, all in harmony. I use quotes when I say bad because, like Candida albicans, we all know Candida infections are bad, but we have Candida native to our gut. It's when it becomes overgrown, it's problematic. And so even pathogenic bacteria, we even have Clostridium, right? We all know C. diff, Clostridium difficile. We have dozens of Clostridium species in the gut, but it's about harmony. And the analogy I like to use, everyone can relate to, is picture a community with police. All your good bacteria are the police. The bad guys are the crack dealers. Now imagine every gas station, every grocery store only sold crack. It's an overgrowth of bad bacteria. It'd be a pretty bad way to go. The whole community would just collapse. But if we have it all in harmony, whether we like it or not, crack dealers still contribute to the economy in some way, shape, or form. So do these, quote, bad bacteria. They have a role to play, but it has to be in check. It has to be in harmony with the rest of the ecosystem. And when we don't have stomach acid, we are very easily disrupting that ecosystem in many different ways. Some we're probably still don't even know of yet. We're still really just learning about the microbiome in the grand scheme of things.
Yeah. And so I want to make sure for the listener, we're talking about there's bacteria that can be really problematic. Those are more the pathogenic ones. But I think, I just want to tie on to this. There is a lot of what we call commensal bacteria. These are the bacteria that should live in the GI tract. And I use a very similar analogy, but I use it like my neighborhood. There's 114 houses in my neighborhood, right? Everybody deserves to be there. They all bought the property. They all live here. Mm-hmm. But we would call those, all the people that live in those houses, the commensal bacteria of my neighborhood, right? Those are all the bacteria that should live there. But if my neighbor, Jim, I love him to death, but if he's having parties every night with 30, 40 people, even if they're my neighbors, it's a problem, right? And if my other neighbor decides they're going to go to Florida for 6 months and not have anybody coming in to take care of their property, take care of their yard, that'll be a problem. So when we're thinking about bacteria, and this is why it's, I think, to me, so important that we make sure that people understand it's not just things that bad bacteria, because that's what the medical doctor is looking for, is the bad stuff, the pathogenic stuff, the stuff that causes disease that they're aware of. But it's the commensal bacteria more often that get out of balance that can start to contribute to problems. And these aren't abnormal bacteria. This is why your medical doctor is not checking for them. Oh, they're the bacteria that should be there. They can't cause a problem. They can cause a problem, just like my neighbor Jim could cause a problem if he's having a party every night, because it's creating a disruption of normal everyday neighborhood practice. So that's why it is really important when we're thinking about what's going on in the GI tract. Everything we do, it's not always creating it's not always this pathogen, this thing that's going to cause a disease state in almost everybody. More often than not, it's the commensal bacteria that can overgrow or undergrow, and then nature does not like a void. Something fills the space, and it could be just another type of commensal bacteria that then starts to overgrow, but changes a lot of the immune regulation, the cell signaling, the defense mechanisms, the mucous membrane concentrations, the immune system in the GI tract, that really starts these low-grade dysfunctions that ultimately wind up being the diseases like you're talking about, right? The colitis, the Crohn's, these things that we go, oh, there's the pathology. But how did we get there, right?
Yeah, well, it was beautifully said. And I think those two analogies between the crack dealers in a nice neighborhood going on vacation really tells a lot about us as different practitioners. I think you have better bedside manner than I do.
So what's then, once we think about it, so we've got acid issues, let's talk about the next step in the pathway there, because what happens if that food starts, we don't have the stomach acid, we talked about it, we don't have enough digestive, that can slow down the breakdown of the food. It can allow for bacteria to overgrow in the GI tract. But what other challenges occur right there in the GI tract if we don't take time, if we don't have appropriate stomach acid production? What other challenges can we have as just from our everyday health and absorption of nutrients if we lose those first couple steps?
Well, the biggest one is the end product. I mean, Henry Ford got famous not necessarily for the motor car, but for the assembly line, right? I mean, even Ray Kroc at McDonald's way back when used the assembly line model. But we know an assembly line has to work in precision. Everything is timed out. The stations are set. Everybody has a job to do. Imagine if Ford Motor Company, one person just left the station, right? The end product, you get a car with no engine in it or no roof or whatever's happening. And so the same thing happens in the body. The end product is food that is broken down, digested, and absorbed in the form of nutrients in whatever form, whether it's carbs, fats, proteins as macros, or vitamins and minerals as micronutrients. We need all of it. And it's this assembly line working in harmony that does that job. But if we lack the first steps, the first basics, everything goes awry at the back end. And we can have food that's not broken down. We can have a lot of inflammation in the gut, which further contributes to a lack of ability to absorb. So the ultimate end result is a body that is fed but undernourished, because one, when you're inflamed, right? Picture when you're sick. We all know I'm sick, extra vitamin C, extra rest, extra water, extra resources your body can use to recover, extra sleep when you're sick. When you're inflamed, it's pretty much the same thing. Your body needs extra resources because it's trying to send firefighters to put out the fire. We need to recruit from other counties. We got to bring other guys in because we're short on resources. The problem is there that if you're this short on resources for long enough, people with gut issues, minus the inflammatory things in their joints, whatever else, end up with hair falling out. They end up with really sensitive, brittle teeth because your body, we talked about the pecking order earlier, right? Even though we as a unit, my brain might say, well, I'd like to have healthy skin or healthy hair, but your body says, no, man, healthy heart, healthy liver, healthy gut is much more important. So it actually will take resources, minerals from these other places, leach them out, right? Like a mom who's pregnant, who doesn't eat enough food, the baby will steal that from her bones and she'll get osteoporosis because the priority organism gets to say where the nutrients and resources go. And so if you're not breaking down, digesting, and absorbing, one, you're already not giving your body the minimum it needs. 2, you're in a deficit requiring excess. So you're using them. And 3, you're robbing them from other places. So you end up with as much breakdown process as you could possibly imagine in the entire body based on those things alone.
Yeah. And so to add to that, like if you don't have the acids, there's so many nutrients. And this is, I think, what he was talking about, you'll need more is there's so many things that need the acidity in the stomach to be absorbed.
Like iron,
B vitamins, magnesium, right? So there's so much stuff that needs that. And what drives the release of bile, pancreatic enzymes, of bicarbonate is the acidity of the chyme, which is the contents that are leaving the stomach and entering the small bowel. So if that isn't broken down and you don't have the right pH, you're probably not going to get appropriate release of acids, of enzymes, of bicarbonate, of all these things to do these next steps, which is what Josh is saying. If these first 2 steps essentially aren't done well, you're destined to have undigested food because you don't have the acids, the enzymes to further the breakdown process. Those foods are going to sit in the GI tract and they're going to now be poorly digested, and bacteria may find these foods and say, whoa, we're going to start fermenting these foods, creating more gas, more bloating, more pressure, more fermentation products. And then all of that can trigger some of the inflammatory stuff that goes on. And when we think about, a common term everybody uses today is SIBO, with small intestinal bacterial overgrowth, or SIMO, small intestinal microbial overgrowth. It's one of my opinions regarding why it's constantly coming back in so many people is we're not dealing with the first steps very well. And so we're saying, oh, we'll just take an antimicrobial or an antibiotic and we'll kill the stuff. And then we're surprised when it comes back 3 months later. Well, why would we be surprised? All we did was kill the opportunistic organisms that were there that took advantage of the situation. Instead, we need to sit back and say, why am I not killing some of the stuff on my food? Why do I not have enough acid to kill some of this stuff? Why do I not have enough bile acids coming in, which are a direct antimicrobial at the top end? Why don't I have enough pancreatic enzymes to kill it? I mean, you have all the tools in place to kill that bacteria as it's coming in. And so we need to, instead of just killing, we need to ask that question, what's breaking down to allow the bacteria to grow in the first place? Do you agree with that?
Unequivocally. It always comes back to the why. That's the classic why in functional medicine, right? Western, that's the what. That's what we're taught because that's what our doctors tell us. What? Acid reflux, antacid. What? Bacterial overgrowth, antibiotics. We go, why did it occur? Because it will occur again. And if we're not getting the root causes, I look at it like going to the hospital. This is what I talk with any root of any disease. Imagine going with a thorn stuck in your hand. It's been there for months and months. It's swollen and infected and it's pussy and bleeding. And they give you ointment for the pain. You'd be pretty pissed off about that. You say, pull the thorn out of my hand. But we don't look at it in the same way when it's a chronic inflammatory condition that we can't see with our eyes, right? My gut is inflamed. I'm having bloat. I'm having acid reflux. There's a thorn. You have to pull it out. And most of us are just putting ointment on it.
Mm-hmm. Yeah, I agree. So let's talk about a couple things that are kind of big topics today. So we talked about diet. I agree with you from a dietary perspective. I'm a whole food. I think that's where 80% of your should be whole food, the way it came out of the ground, out of the water, right off the tree. And I think if we just did more of that, we'd be okay. But today we've got all these experts and food religions talking about what's the best diet. I have my opinion on this, but there's some people who say this is the thyroid diet, this is the IBS diet, this is the low fat. What is the diet? So the person who's listening to this may be saying, okay, so I need to eat whole food, but this guy says I can't eat dairy. That guy says I can't eat gluten. This person saying I can only eat meat. This person saying I can only eat veggies. Like, what am I supposed to eat?
I'm nonpartisan here. So when we look at the diet side, I do advocate for an animal-based diet. I find it tends to be the best. It's the best on my gut, my clients for the most part, 90+%. Yeah, maybe 90 is generous. Maybe 80% respond very well to an animal-based diet, provided they have the tools to break it down. A lot of people go, I can't digest red meat. Well, yeah, you're not producing stomach acid, you're highly inflamed, you're highly undernourished. You can't produce the tools you need or the enzymes you need to break it down. Of course not. So maybe we do go with a plant-based smoothie and protein powders and supplemental foods for now. But whole foods are just foods. They grow in the earth, on a tree, in a bush, they fly, they swim, they walk, ideally not crawl. I'm not into that. But people eat that, and that's fine. And so I do subscribe to an animal-based diet for the most part. However, I also recommend diets depending on the client based on the GI profile. If I have somebody coming in, I typically would say, for the vast majority, people who have huge overgrowths of bacteria, be it opportunistic or quote bad bacteria or the good bacteria, they don't respond well to carbohydrates, sugars, starches, fermentable things, fruits, because that's bacteria food. Right? If we look at bacteria like fish in a fishbowl, the fish food is the prebiotics. The probiotic, the living organism, is the fish, and the postbiotic is the fish poop. Now, in an ecosystem, there are things that eat that poop, that consume it, that upcycle it and reuse it. And our bodies work the same way. But if we have too many fish and too much poop, it's a problem. So too much prebiotic fibers, fermentable carbs and starches and things are super problematic. And so those people, I go very animal-based, if not carnivore, if they can handle it, in order to starve out some of these microbes and control some of the overgrowth until we control that in other means. But if I've had people come in who have relatively decent looking or non-problematic opportunistic or bad bacteria, but very poorly grown commensal bacteria, I might go to a supplement of like spore probiotics, especially if they were C-section and bottle fed, not breastfed. I might get some spores and some basics in there with fermentable or fermented vegetables and other things, depending on how they break them down. So there's based on the bacterial profiles and based on the individual, because bacterial profile A, 15 people could have that, but maybe 5 can't tolerate that diet. And so it does become an intuition thing. I'm big on intuitive eating, and we have to listen to our clients. Somebody comes into me, happens all the time. I say, here's what I recommend. This is well accepted. They go, well, I can't eat that. I say, great, but it's on my list. I'm supposed to eat it. I said, no, it causes you problems. You know better than I do what foods hurt you. I won't know unless I sit and watch your belly blow up. And so everyone's different in that regard, but that's sort of my general take. Both can be good, plant-based or animal-based. In general, for a healthy gut, I say animal-based tends to be the best in my experience, but it is dependent, and every individual will respond differently.
Yeah. And I think for the listener, I think if you start with kind of a whole food-based diet, that's your starting point. Then you work from there. I think the biggest challenge with all and my listeners have heard me say this over all the time, is any one of those diets could be beneficial for somebody. If you've been carnivore and you're struggling with your GI tract, switching your diet to something else, a whole food-based diet, may give your gut a break. If you've been vegetarian but you're struggling with chronic health issues, it may be good to change your dietary strategy, at least in the short run, to change the bacterial content and to change what's going on in the GI tract. So any one of those whole food diets can be beneficial. I think the problem we have is that a lot of people have their food religion, and so they stick to their guns, and we've taken all these healthy whole food diets and we're kind of shooting in at each other instead of really putting the emphasis and all that attention where it should go, which is to all the processed food that everybody's consuming. So if you want to be a healthy vegan, and you've got a lot of work to do, I think, in most cases, but if you're healthy eating that way, that's great. But if you're eating a vegetarian or vegan diet that's primarily processed food, maybe the big thing to do is to get you away from those processed foods. And if you're still struggling on a true vegan diet, then maybe making a change to a paleo diet or Mediterranean diet or an animal-based diet may create a short-term change in your gut flora, but then helps everything calm down. I'm an animal advocate, so I'm big on in that side. And I typically see a lot of people who they say they're vegetarian or they say they're vegan. And I don't really care if you're healthy. I don't care what diet. If you're healthy and you're doing well, I don't care. But if you're doing that type of diet and what you're eating primarily processed food, you're going to be in trouble. You're already going to be struggling a little bit behind the 8 ball unless you're a really good, really, really diligent vegan or vegetarian. But if you're eating primarily processed food as part of your mainstay of your diet, you're in trouble. I think you're going to be in trouble.
Oh yeah, my opinion is simply this: if God didn't put it on the earth for us to eat, we should not be eating it. And Ben Azadi has a great saying. It's one of my favorites. I don't know if he got it from somebody or what, but he had left it at one of his conferences, and he says human beings are the only species on Earth smart enough to make their own food, but stupid enough to eat it. And it is just so true that these foods, they're food-like substances.
Mhm.
For since I don't care if you believe we've been around for thousands of years or millions of years, it doesn't matter. Human beings were never designed to eat the things we eat today. We wonder why we're all so sick. It's just
Yeah.
we look at a lot of indigenous tribes. They may have health issues for different reasons, but they don't have the same fertility issues. They don't have the Alzheimer's and the breakdowns the same way. They don't have the childhood acne the same way. They don't have the teeth rotting. Every
Mhm.
National Geographic magazine we've ever seen before 2005, when Coca-Cola started handing out Coke over there, pearly white teeth. They don't brush, they
Mhm.
don't floss, they don't need to, because their oral microbiome is intact. Their nutrition is intact. They're eating from the land. They're walking around barefoot. And there's a reason in North America and a lot of European countries, we have nursing homes going up left, right, and center. It used to be 80, 90 years old, you're in a home. Now it's 70, some in 60, early onset Alzheimer's. But these other countries, these indigenous people living on the land, not eating fake food, petroleum, and chemicals, they have elderly who still hunt. We have
Mhm.
elders who rot. Or so they
Mhm.
have elders, rather, we have elderly. That really took the sting out of the statement.
Yeah.
But that's the idea, is their elders are capable. They're aging well. Our elderly are dying young. And
Yeah.
that's a major problem.
Yeah. I think that's a huge issue for what's going on. Is we just eat way too much processed. Yeah. So I'm talking to Ben on Friday, so I'll see if he brings that
Oh,
comment
that's
up.
rad. I'll be
Um,
seeing him soon in like next month. We're going to Miami. What a
I,
small
I
world, hey?
I'm headed to Miami in February as well. So, I'm not
Maybe
sure
we'll
when you're
cross
there.
paths.
Maybe we'll cross paths. But let's talk about another thing that's I think is creating we see. I think it's an issue and a problem is we see a lot of people doing. Um, they go gluten free, they go dairy free, they go this free, that free. Um, Gluten gets a lot of blame. Everybody
Mhm.
thinks if they just go gluten free, they're going to be fine. What's your take on gluten first? Is it a problem? Is it a problem? Is it not a problem? Is it creating a problem with the gut biome? What's the real issue?
Mhm.
We've been eating wheat for a couple thousand years. What's the issue with wheat? Is it a problem? What's your take?
Mhm. Well, it's interesting. So I think personally wheat and gluten is a major issue. Now, whether or not we used to eat it is sort of beside the point. I think it's an interesting point of attention, but it would be beside the point because it'd be hard pressed not to find any GMO wheat or grains of any kind, and at least in modern agriculture. And so it's foods we're never meant to eat. I mean, there's a reason Vladimir Putin banned GMO crops and cattle and made it an act of terrorism to grow, because they're horrific for us and we know it. But the United States, they don't. The FDA doesn't care. They care less about our health. And so, talking to some doctors will say, yeah, well, stable isotope technology shows us that, yeah, there was other heart disease and this and that. We could see what people were eating, even ancient Egypt, a lot of grains. But if you look at the depictions and a lot of the art of the general population, they had extra, it looked to be estrogen with man boobs and extra fat. We look at a lot of grains, legumes. I mean, gladiators, right? We think, well, gladiators ate beans and rice. It's good for them. Well, they were slaves.
Hmm.
Gladiators were slaves. They ate slave food, which was cheap because they were going to die. Why invest in them? And that gave them extra layers of fat. The story would go to be able to take stab wounds or slice wounds and bleed more, make a better show, and not die. And so, in that regard, grains, legumes, we can see as problematic. Some will say they're fantastic. On the other hand, a lot of these issues, I don't think so much is the food. And whether it is or not, that's a different point. But I don't think it's the food as much as it is the production, the GMOs, the processing, the chemicals. But for gluten specifically, my understanding is this. Right, we have, as you know, we have these toll-like receptors in the body and
Hmm.
TLR4 between the stomach and small intestine. And when gluten comes in, your body looks at it and recognizes it, says, "Hey, wait a minute, that is bad. It looks like a pathogenic bacteria. It looks like something we don't want." And so we talked about leaky gut briefly, but leaky gut is a good thing. Leaky gut is actually a defense mechanism. Your body opens up the pathway, like putting your thumb over the hose in the driveway to spray something off. If we get something we shouldn't, How many listeners? I used to get this with Tim Hortons coffee. I drink it, 5 minutes later, I'm in the bathroom because my body says we shouldn't have that. It rushes it through, brings in the water, creates loose bowels to clean things out. The same thing happens with gluten. These TLR4 receptors, they stand guard at the door and they say, you should come in, you should not. They'll Gandalf them like, you shall not pass. And if it lets it through, quickly it's trying to get rid of it. It might drip things through. But ultimately, these toll-like receptor number 4, they look at gluten and say, we don't want you. You're bad. You're a pathogen. We identify you. You look like the bad guys. And so they let it through, but they open up the floodgates, creating leaky gut to try to wash things out. Now, the lucky people, this is from Dr. Tom O'Brien. He says the lucky ones are those who get gut issues, the ones who experience this directly and say, yep, I'm having inflammation in my GI tract. Bloated, I shouldn't have gluten or wheat or grains. The unlucky ones are the people who many days later get acne, joint pain, cognitive issues, clarity issues, mental clarity like focus and memory, attention issues. Those are the people who are unlucky because we don't remember we ate those things. We don't track it. If I don't eat it and break it in hives, it's not a problem as far as I'm concerned. And so if we're not looking for it, we don't find it. And so my opinion on gluten is that it creates leaky gut for everyone. That's my understanding. That's what I've been taught from Alessio Fasano, Tom O'Brien, the gluten guys. But the severity of that gluten intolerance depends on the person. So if someone wants to jump on a trampoline and their leg is broken, like they have inflammatory bowel disease, they are debilitated, gluten is going to be horrific for you. It's also very bad for any kind of autoimmune disease, particularly thyroid. It can mimic a lot of the same things. But somebody who's very healthy, an Olympian, can jump on a trampoline with healthy legs and not break. So if you have a very healthy gut, you can tolerate that pressure a little bit more. But my understanding is it creates leaky gut in everyone. Now, leaky gut, like we talked about, is a good thing. It flushes things out. But if you're constantly eating gluten and it's sustained inflammation over time, it's sustained leaks in the gut, that leaky water coming in to flush things out, that's a unidirectional pathway. It brings water in. But if it's leaky gut sustained and it gets worse and worse, it becomes bidirectional. Water can come in to flush things out, but things can leak out into the body, these macromolecules leading to allergies and food sensitivities and inflammation everywhere, immune issues in the works. So gluten is something that I do try to avoid, especially the Crohn's and colitis space, because it can trigger inflammatory markers and autoimmunity for up to 3 months, one single bite. So even for those who eat it on special occasions, I only have it every few weeks or on birthdays and Christmas, you're inflamed all year round. And so it's something I tell all of my clients to avoid as if it was alcohol or sugar.
Yeah, I don't know if it creates. I know the works of both of everybody you talked about, and I've read all the stuff and done all the studying. But we also take a look at people who consume a bunch, and we look at some of the markers that might indicate potential problems, and they consume it, and we don't see markers of
Of course.
inflammation or permeability. So I think there may, if you go back to the original principles, they eat whole food as close to the way it came out of the ground, out of the ocean, all those things, and you're probably not eating a lot of grain because you're not chewing on a stalk of grain. But I think one of the bigger challenges is what we do, and I agree with that part of that statement for sure, is what we do to process some of these foods, the chemicals, the fertilizers, the antibiotics that we're throwing
Mm.
on these products, and then we're consuming, especially when it comes to wheat-based products and some of the other like soy-based products and some of these other things that are either Roundup ready and they're getting sprayed with Roundup, or we're using Roundup to kill them and make it easier to process. We spray the wheat field with Roundup, it turns it brown, it's easier to harvest. It is these chemicals that are antibiotics that then that alter our gut biome that I think is the biggest issue. But it could be both. Like, I don't know that we really know that what the definitive answer is, but I think most people would agree, probably the Roundup is probably not a great strategy. I think that's why they're trying to get that out. That doesn't mean whatever they replace it with is going to be better. Um,
Right.
but I think I typically advocate more of the whole food diet and a lower gluten diet as well. But I also think that you shouldn't just replace all the wheat with some other processed food either. I don't think that's the best strategy.
No, and
So
we do. We look for gluten-free, low carb, carbonate bread, right? Like substitutes that aren't real food. But I agree with you, Eric. I think is it a question of gluten itself, or the intolerance levels based on inflammation, based on genetics, based on other systemic issues, based on your microbiome. I mean, we just don't have the resources to test. I mean, we know you and I share 99, arguably 99.9% of our DNA as total strangers who we've never met in person, but we share max 20 to 30% of the DNA of our gut microbiome. Right? We have 3 million genes. We only share 20 to 30% of it. And so who knows what the factors are in there? But I agree with you. My take is that it's such a common problem and so high risk. I'd rather just pull it out. And we get a lot of people who say, well, red dye 40. Yes, there's all these correlative studies. They say it's correlation, but it doesn't equal causation. I'm like,
Right.
how many times does that guy have to show up to the party and things go missing from your house before you stop inviting him? You know?
Right.
So that's what I do with these types of foods.
Yeah, I think the big challenge though, there's a slippery slope that people start to go down. I remove this, I remove that, I remove this, and remove that, and before you know it, because they have excessive permeability in their GI tract, because of dysbiosis, because of low short chain fatty acids, because of low bile acids, because of other factors, they're getting undigested proteins of whatever they eat crossing that barrier. And so now these peptides, for the listener, you eat food, the protein breaks down into a smaller section called a peptide. The peptide breaks down even to a smaller piece called the amino acid, which is what we really should be absorbing across the GI tract. But because we have too much permeability, and Josh is exactly right there, you have to have some permeability in the GI tract. Think of the permeability in your GI tract like the screen in my window. Small little teeny tiny holes to allow things to come, let the air come in, but keep the bugs out, right? There's still permeability there. There's a lot of permeability there, but it's controlled permeability. If I come up and punch my fist through your screen window, I increase permeability, but no, I'm really not getting that much more air in. But what I am now doing is now I got the butterflies, the bees, the wasps, the flies all coming in the house. And while they're all beautiful outside, inside my house, they create chaos. And that's really one of the big things that's going on in the GI tract is when you have poor digestion, low bile acids, low stomach acid, poor pancreatic enzymes, and you've got a number of these factors that reduce digestion, and you get the bacterial imbalance and this inflammation that creates more of this permeability. Now these undigested peptides cross the barrier. So we see people, and I'm sure you see this too, where somebody says, well, I went gluten-free and I was good for a while, and then that went away. Then I started having problems again. So then I went dairy-free and I was good for a while. And then I started having other problems. And then I had to give up almonds, and then I had to give up this, and then I had to give up that. And they're like, now I'm down to chicken and broccoli. And that's all I can eat. And I'm like, you had a digestion problem is what you had. The food sensitivity, food intolerance thing, that's the result of the digestion problem. If you deal with the digestive problem, probably most of those foods you'll be able to put back in time, but you have to fix the digestive problem. You can't keep subtracting food and getting higher and higher concentrations of a food that you can't break down, because now you have a greater probability that that food's going to create problems. Do you see that in your practice when you're working with people?
All the time. And unfortunately, I see it mostly from people who will call self-medicating and managing their own symptoms, their own situation by themselves, and trying to just, find stuff on the internet. Oh, it's elimination diet. I'll keep cutting things until I'm fine. And they're, like you said, they're down to just chicken and rice or whatever basics. And eventually even that becomes a problem because the leaks were so severe. There's so many fists in the screen, right? Fist equals causation, not correlation. And so if we keep following that through, eventually you're going to be sensitive to your chicken and rice. And now you're on an elemental diet and your basic supplementation because it's just the bare bones micronutrients that you can maybe absorb and not die. And we never really got the root. And it's a very insidious problem. I describe a lot of this to my clients, especially these accumulative processes like the Crohn's and colitis, from someone who maybe has bloat today, 30 years has ulcerative colitis, or a year, whatever the timeline is for the individual. It's like walking around with a pair of shoes without socks. You're going to get a bit red and blistered and raw, and it will bleed. It's this rubbing, wear and tear process that's eventually worn through. Now you have a problem. Now you're trying to address it, but you're just playing catch up. We did all the wrong steps along the way. You did everything but put socks on.
Yeah. Everything's a spectrum disorder, right? Everything, right? It starts with some dysfunction and then eventually becomes a disease. Unfortunately, sometimes we don't consider there's any problem until we see the disease, right? It's like saying you don't have cardiovascular disease until you have your fatal heart attack, or you
Yeah,
don't have a blood sugar regulation problem until you have diabetes. No, it
it's
took
the
me 20
Western
years
way.
to, right. It took me 20 years to develop this. So, um, let's
They
talk.
really,
Go ahead.
I was gonna say they really take the if it's not broke, don't fix it a bit too seriously. There's no proactivity or very little
Mhm.
proactivity in Western. If we can't put it into the slot of a disease or of a diagnosis, we go, we don't know what's wrong with you, or it's idiopathic, or it's whatever, and we just go to manage the symptoms. It kind of full circle from the beginning of our conversation. We put people in the middle, and we say, well, we don't know. That goes for everything. I mean, I knew a fella, he had a torn shoulder. The surgeon wouldn't operate until it fully separated, but he had no use of his arm anyways. And so we wait for people to break before we intervene in Western, whereas functional says what's going on now and how do we prevent it later. It is preventative medicine. It's proactive, not reactive like Western is.
So you mentioned an animal-based diet, and there's people that are going to be, whether it's carnivore, carnivore-ish, carnivore adjacent, uh, animal-based diet. There are people that are really ardent against an animal-based diet, are going to say more cardiovascular disease, more ill health. What about TMAO and all these other things that can be um, problematic from eating meat? What do you say to those things?
Again, I think it comes down to not the food being the problem, but the person consuming it, right? Very rarely is it really the food. Again, I'm talking about foods, whole foods, not food-like substances. Now, you get the carnivores, you get the Paul Saladino, the Anthony Chafee, the Sean Baker, and they're all meat, or at least animal based. I think Saladino's gone to some plants and some fruits, honey, basics. But it really seems to me, in my experience, working with some of the worst gut disease, Crohn's and colitis, is that it's the person's inability to break down, digest, absorb, and utilize properly. And that becomes more the issue than the food themselves. And I think so many of us have so many imbalances that we're not really aware of, or maybe we can't categorize or classify or put a diagnosis to, or whatever it is in such a way that we know these things are problems. And so for us, we're just consuming foods and hoping for the best and blaming it on the food itself. And then we have skewed data. I'm sure you saw that really embarrassing study Harvard put out, I think it was earlier in 2023, where they said red meat is bad for you and causes diabetes, but the red meat they were giving was lasagna and sandwiches with a glass of pop. And so the data we get is sometimes cherry picked, but there's also everything we have. There's supporting studies on all sides. It doesn't matter what we pick. And so we have to look at the individual and say, are you breaking down, digesting, and absorbing all of your foods in the most efficient, effective way possible? And we can go right down to like an oat, right? An organic acids test where you can see on a cellular level what your body is doing and how it's performing and how it's breaking down and utilizing nutrients. But on the other hand, who knows, right? It's a bit of a crapshoot, which is why I do go case by case, and we want to check in regularly, test, assess, retest, and repeat this process over and over to see what's working and what's not. But I don't really blame the foods. I typically blame the people.
Yeah, I think we unfortunately you see um, a lot of misinformation put out, especially when you look at some of these scientific papers, like you were kind of referring to, like when they talk about a specific diet, when you really look at what they're suggesting is the diet that you gave them, it doesn't reflect what a maybe somebody who's uh, a animal based person would actually eat, or what a keto, they may say, oh well, it's a high fat diet that's similar to McDonald's and Burger King and fast food, right? So that's a high fat diet. That's the same high fat diet you're talking about with eating your animal based. Well, no, not necessarily. So we always have to look at those things. But I do think, um, for in general, I would agree with you. Eating a lot of animal based foods is probably not an unhealthy thing to do. The issue is in the and the reason you may not feel good if you switch to that from what you're doing is A, it takes time for your biome to change. And two, you may not have the tools in place to really break those things down.
Mm.
And so improving the digestion will often allow a lot of people to heal and improve. And I think a lot of people are shocked when they see how much actual protein they eat versus how much they should eat. And then they
Mm-hmm.
start consuming more protein, uh, good, healthy sources of protein. They feel better, they function better, they have more lean muscle mass. everything just starts to get better, because the proteins, and especially the animal-based proteins, are the building blocks for your tissues, for your muscles, for your hormones, all these things.
Well,
The
even your
carbs,
phase 3 liver detox, right? I mean, we need
yeah,
that for everything.
yeah.
It's great you bring it up, Eric, because I mean, I went carnivore earlier this, well, just I guess for January now, but earlier last year, on the advice of Dr. Chafee, I was like, well, I'll give it a shot. I went full carnivore. I had diarrhea for a week straight, but I was committed. But after that, I never felt better. I did my blood labs beginning of the year, as well as a GI map. I was dealing with a bunch of other issues that came up for a bunch of other reasons, but my stool samples and my blood work had never looked better after, I think it was 4 months or 5 months on carnivore. And so that's because at the time, that's what I needed. But now I do consume fruits, I do consume other things, and I feel even better. And so I don't, like I said, I don't advocate for one direction or the other, but I love what you're getting at. Like, we need more protein, we need nutrients, but it can be found, most of it, in our meat if we're getting proper grass-fed, finished, pasture-raised, hormone antibiotic free where we can.
Yeah, and I think that what you said kind of goes to the point we made before, is maybe the change in the style of your whole food eating. Hey, I'm doing more paleo. I'm doing more vegetarian right now. That was good enough to make a change. Hey, I went more carnivore. I had a cardiovascular physician who came to see me. Had diabetes, high blood pressure. They're getting ready to put him on insulin. He's on a bunch of meds, overweight, like 60, 80 pounds overweight. And he's a cardiovascular surgeon, right? So um, at the time, I looked at what he was eating. We looked at his GI testing, and I said, you know what, let's just do. We did shift him to a carnivore diet. I said, we're going to do this for a few weeks, just kind of see what happens. Um, and he was like, "You're doing. We're going to do what?" Like, because it
Perplexed.
wasn't in his wheelhouse, right? Like, he was doing things that he would have told his patients, but it wasn't working for him, right? And then to make this wholesale change, he said, "Do you think that's a great lifestyle?" I'm like, "No, I don't want it to be a lifestyle. What I wanted to do is I want to shock your system a bit and help change that biome." And we provide them bile support and gallbladder support, and some digestive support to help with that transition and change. But the ironic thing is that once he did make that, and he committed himself, really committed himself, and within 30 days, I mean, I think his he was off at least one or two of his blood pressure medications, no more need for insulin. Within 6 months, back to his high school wrestling weight, off all his medications.
It's
And we
amazing.
had this discussion, like, he's like, cannot believe. I was like, you could do this with your clients. He's like, I couldn't do this with my clients. Nobody would refer to me
Hmm.
because they have a standard, right? And he's like, I gotta be in business. This is what we do. And I felt for him, because I could see he was kind of trapped in this. Man, this can help a lot of people, but this is the model I work in. You know, I can't do, I can't do that here. And it was a tough situation for him. Um, and even at a point, I think he even tried to shift back to his old eating style, and he started putting weight on, doing those things.
Hmm.
And just not that he was stayed carnivore, but wanted to shift back to the original lifestyle that I met him at. And he's like, I'm gaining weight again, my blood sugar. I'm like, of course it is, right? The same habits, the same behaviors are coming back. Why would you expect anything different? And he was like, well, I was
Hmm.
hoping that we would just fix it, and then I could go back to do what I was doing. I'm like, no, what you were doing was what was causing the dysfunction. So if we go back and do that, it's going to create more dysfunction. We should keep, and I think we see that in our practices. Sometimes people say, well, I'm going to work on my gut for a bit. I'll do 30 days, 60 days, 90 days. Now I'm going to go back to my lifestyle that I was doing before. And then they're shocked, and that they have their symptoms come back. And then they
Hmm.
say, Josh, like, this isn't working. Well, what do you mean it's not working? Well, I'm back, now I'm having problems again. Well, what are you doing? What are your habits? What are your behaviors? What are you consuming? What are your lifestyle choices? Well, I'm doing a lot of the same stuff I was before when I first met you. Oh,
Yeah. So stop doing that.
right,
It's
right.
like,
It's not that hard. It's not sexy. It's not that hard. But I think that's what people are hoping, that you're going to sometimes give them a supplement solution that's going to fix everything. And then they can go back to the bad behaviors that created the dysfunction, and everything will be okay.
hmm.
And it just doesn't work out that way.
It's like you got to exercise to get in shape, but you have to exercise to stay in shape. And unfortunately, there's a lot of emotion and culture around food and drinking. It's celebration, it's commiseration, it's all kinds of reasons we drink. It's birthdays, it's New Year's, it's whatever. But if we go, that's the thing that caused the issue in the first place. Going back to that is going to create the same problem. But we do have a bit of a disconnect, or we're emotional, whether we admit it or not. Not emotional, like I'm going to cry, but maybe we're irritable, we're angry. It's not fair. I want this, and we go back to these things because culturally, bad food, we're raised on it. Get your kid to be quiet, give him a sucker. That'll shut him up for a while. When I was a kid, my family would sit down and watch a movie. There's always snacks. I'm 31 years old. I sit down in front of a TV. I'm snacky. And it's a habit that was ingrained when I was a kid. So I got to find better snacks because I'm going to eat some garbage. I'm a nutritionist. I'm a gut specialist. I'm still going to eat crap. So I'll grab cashews or something that's crunchy, or I'll bake some chickpeas. So I have that like crunchy feel. But those are some things we can do, but it's habit, it's emotion, it's society, it's cultural. Every country, every culture rather has some kind of culture surrounding food. Ours just happens to be really bad food and way too often, right? Oh, I worked hard, treat myself. Like, no, you're treating yourself to heart disease and gut disease. So stop that.
Yeah, it's a challenge. So we're going to wrap this up. It's an hour and a half, cruised by pretty quickly here. Let's finish with and I think we started with this, but let's just reinforce it. Like 3 simple tips that everybody should consider right off the bat for general health. If you have GI problems, even before you consider seeing a functional medicine practitioner, what are the top 3 things, top 3 recommendations?
For all general health?
All general health?
I like that. That's a really good one. So number 1, slow down. Take a breath, eat. We'll go back to what we were talking about earlier. Take a few breaths, slow down, cook your food as much as possible, like using real food, and take that time to just sit and breathe and enjoy. Be social. There's all kinds of things and behaviors that way that do correlate to better health, better digestion. The second one, get outside. Get some sunshine. Sunshine's not evil. Skin cancer, we never really saw, or very rarely would see skin cancer until the introduction of processed foods and seed oils and inflammatory things, where the sun then became inflammatory to us, right? Even our windows, they block infrared light. We get a lot of that nasty UV that can cause burning, but we lack a lot of the good benefits because the windows can block those frequencies of light out. So actually get outside, get some fresh air. At the very least, open up the window or the door and have the screen open to get some fresh air in. According to the Environmental Working Group, one of the top causes that's registered as one of the top 5 environmental pollutants is actually indoor air. So we should be breathing outside air and letting it circulate. That's number 2. Number 3, get some bloody nutrients in you. I'm a big advocate for general multivitamins. Again, it's not sexy, right? It's eat healthy, get outside, and take nutrients. Like, that's not a sexy answer. It's rudimentary, but so many of us, we're having tech issues. We're looking for antivirus software, a tech guy. Turn off the power, right? Start with the basics. So get your nutrients in. Most of our soil, our food is very nutrient void. 0405 study from University of Texas actually compared oranges from now to say 50 years ago, whatever it was. Say we need 8 now. Studies even indicate upwards of 20 oranges now to get what we needed maybe 100 years ago. Because our soil is so void of nutrients. There's no biogeochemical cycling, right? Example of that is apple falls off the tree, gets into the grass, decomposes. Cow eats grass, I eat cow. That's that biogeochemical cycle. We're lacking that because our crops, our monocropping in big agriculture is tilling. It's dead dirt used to hold a seed, which is done with fertilizer. So we don't have these nutrients cycling through. So we're lacking them in our food. So slow down, chew your food, take some breaths and eat. Number 2, get outside, get some fresh air and some sunshine. Number 3, take some good quality multivitamins, some minerals if your gut can handle it, and some bloody magnesium. Man, I recommend most people work up to, say, if they can, 1,200 milligrams of like a magnesium bisglycinate every day because it's used for every function in the body nearly, and we need it.
Yeah, I think those are all good. We at some point we'll have another conversation about magnesium, because I agree it's so important. I think the biggest challenge is, how do we measure it, right? I don't know that we've got a great way to measure it, to see what's going on inside the cells.
Heart rate or diarrhea. That's a great way to measure it. If your heart's too slow and you're pooping too much, you got too much.
But yeah, so we've got to find some ways, some better ways. I'm talking with somebody actually on Saturday about different ways that we might be able to check the intracellular level. So I'm going to his lab Saturday to see if how we might be able to do that. But
Is that a podcast you're recording? So I'd love to listen.
I'm actually just going to his office. He does some other cellular testing, and so it was a conversation that we had, and I said, what's a chance that we can test some other micronutrients using similar technology to test what's my intracellular magnesium, calcium, some of these other micronutrients? He's like, we could probably do that. And so I'm like, oh, okay. So we're going down to have that discussion because, we do a lot of different testing for minerals. Like people use hair mineral analysis to assess those, but you get confusing answers from people what that actually means and how valid it is. And we can get inferences to some of these micronutrients by looking at labs, indirect examples of labs, and say, okay, that's probably a B1, B6, B9, B12 deficiency. Some of those things we can measure, but sometimes, look at folate, right? Folic acid is what's getting measured. Is that really folate status? Well, I don't think so. If you really want to know what the folate status is in the tissues, then you got to look at like RBC folate, see what's going on inside the cell. One of the labs where I get some testing done, they're the owner of that lab. He's like, anytime you're measuring folic acid, that is oxidized folate. So is that beneficial? Is that really what we want to know? But that's what a lot of people are using as the criteria for, do I need more folate? My folic acid, that we're measuring the wrong thing and saying it's one thing, but really it's something else. Anyway, I want to respect your time, but give the listeners a little bit of information about where they can hear more about you and what you do, talk about your podcasts and any other things that you can share with people so they can reach out and learn more about what you do.
Yeah. So as you mentioned earlier, the podcast is Reversible, the ultimate gut health podcast. That's spelled reverse able. Looks great on paper, hard to say. But you can reach us through the website there, reverseablepod.com. And of course, that's linked to any help you might want from us if you have Crohn's colitis and severe digestive disease you want help with. Or the easiest way, we do work worldwide. And again, you can link the podcast from there. It's called gutsolution.ca. If you head to gutsolution.ca, there's a bunch of information there. We have free programs for some basic stuff, IBS, constipation, diarrhea-based fatty liver, acid reflux, the works, as well as, of course, if you need some real dedicated help here, you can always reach out to us through there. You can find the podcast through there, but everything can be found at gutsolution.ca.
Awesome. Well, Josh, it was great talking to you. I look forward to maybe talking to you in the future. Maybe we'll see each other in Miami. Who knows?
Actually, I'm seeing you next week for my podcast. So fun.
Oh, yeah, that's right.
Twist.
All right. Yeah,
So
plot twist.
Anyway.
All right. It was great having you on the podcast. And for the listeners, take a couple listens through this one. I think this was, we got a lot of good general information out there, stuff that you can use, share with friends, share with family. And if you like the podcast, make sure you share it. I think there's like, what is it? 5 stars? Is that the one that you typically hit, Josh, when you're rating podcasts?
Unless it sucks, but ideally, yeah.
Yeah, 5. Well, your podcast, my podcast, is typically a 5, and then the other ones, maybe a 1 or 2. All right.
They don't exist on the podcast.
Yeah, I'll sign off. Everybody have a great start to your new year. Take care.